And welcome back. And we're moving into our first conversation this morning discussing health in Belize. We have with us on set Dr. Noreen, who is the PAHO WHO representative in Belize. And we are also joined by Dr. Natalia Largaespada, who is the Maternal and Child Health Technical Advisor for the Ministry of Health. Good morning and welcome.
Good morning. Thank you.
Now, Dr. Jack, this is our first opportunity to be able to have a conversation with you. You recently, or earlier this year, I should say, came into country to head up the PAHO WHO office in Belize. Let's just talk a little bit about your own background and what it's been like since you've been here.
Okay, I'm from Trinidad and Tobago, and I have worked with PAHO for over 10 years. I have been in public health for many, many years.
Yeah.
I would not say how long, but it's a long time. And however, previous to coming to Belize, I was in a similar position in Jamaica for 3.5 years. And prior to that, I coordinated the PAHO HIV program for the Caribbean, and worked in HIV and retroviruses, going back some years, so in research as well. So I have also a research background. Yeah. Yes.
And talking about the mandate of PAHO WHO and the current priorities, what are they at this time?
Okay, the priorities are linked to health and achieving what we call universal health, meaning health for all persons. No one should be left behind. There shouldn't be barriers to accessing health. Barriers like inability to pay, geography, even things like ethnicity could be barriers. So universal health is one of our key mandates because that's the vehicle in which we can carry all our health programs. Of course, if we now look into health programs, one that stands out clearly is non-communicable diseases. That's killing us in the Caribbean. Hypertension, diabetes, cardiovascular diseases, cancers. And they are preventable, and they are modified. We can have modifiable lifestyles. We can change our diet. We can stop using alcohol in excess, stop tobacco use. There are things we can do. And however, it's good to start that prevention early. So non-communicable disease is a critical part. However, we also look at the life course. And I think this morning we're going to touch on that life course because it looks at mothers and children and adolescents and into adult life, because the beginning from preconception and therefore good antenatal care is important for the rest of our lives into healthy aging.
What does that mean, inter-adult?
Into adult life as well as healthy aging. So starts from preconception.
And, I want to bring Dr. Beer into the conversation early as well, because recently she was awarded a specific recognition from PAHO. Tell us about that.
Okay, so Dr. Bear, and congratulations again.
Thank
you. Dr. Bear has received the Health Management and Leadership Award, Health Systems Management and Leadership Award from PAHO. And she received that award for the whole Americas. And she received that award last week at the 56th Directing Council of the Pan American Health Sanitary Bureau. So that was held last week, and Dr. Bear was there. Yeah. And yes, I saw some of it on the television, but I think she can tell us more about it, what actually happened.
Yeah. So Dr. Bear, we know you don't like talking about your accomplishments, but let's talk about what helped you to win this award.
Well, more than an award for me, it's an award for the country of Belize. Because it's really an honor to be on that short list of countries that have won the award. And the accomplishments are for the health system. But I happen to be in the position where sharing what Belize does helped me to earn the award. But we have been utilizing data that we produce as Ministry of Health and data that we get from the different type of surveys that are done in the country to make decisions and implement public health interventions. For example, we recently introduced the HPV vaccine, and in 2008, we did a survey on the prevalence of HPV in women in Belize. We did it only in Belize City. Then we had the opportunity with technical assistance from PAHO to do the cost effectiveness analysis of HPV. So research and use of data that we can produce locally, and using the evidence available help us to decide on these public health interventions. The award considered the last 10 years of work. So in 2006, we reintroduced the Baby Friendly Hospital Initiative in Belize. We have now all hospitals certified, and they have been retaining their status. The next step is to invite the private sector hospitals to be a part of that initiative. So we are just starting that process with technical assistance from PAHO. And there are introduction of the distribution of contraceptive methods, because we know reproductive health is an issue for us. So we use the data from the mix. We use the data from the Family Health Survey to make the case for the government to invest in the procurement of contraceptive methods so women can have access, removing the barrier of payment. No?
Dr. Beard, I can't let you do that now.
Why?
I can't let you so humbly talk down your leadership for 10 years too. You're good.
Yeah.
Because in developing countries, one of the first things to be cut is the budget for health and education. Those are what the International Monetary Organizations try to. And so for us in the Caribbean and in Belize in particular, our challenge is quadruple. So this award for you, for us, for the past 10 years, means a lot more than your humble presentation of it. So excuse me for being a bit rude about that.
You are rude, yes.
Yeah.
And so I wanted to talk about, if you would, not only the successes, but the challenges in terms of getting there. Because you're with the award here, but this is the end of the road. Getting here surely was not an easy task.
No, and maintaining and improving is the challenge. We have several public health interventions, but for people to access and maintain and practice what we recommend is difficult. We have iron and folic acid that we give not only to pregnant women, we expand to children up to primary school, and females 10 to 49 without pregnancy. But they will take the pill one time, we would have to chase them around to get the second, third, and it really help prevent neural tube defects in children, in newborns, and reduce anemia. In 1995, INCAP did a study of anemia among pregnant women in Belize, and they found 45%. We did a study in 2011, the nutrition survey, and they were at 20%. And
half, cutting down by half.
Yes,
and that's where I wanted to explore a bit further, because accomplishments in 10 years, and you're speaking of some of the real progressive campaigns that we're doing with the HPV rollout and access to contraceptives, but also the indicators matter. You know, when you talk about maternal death or mothers, pregnant women or women who've just had children dying, or babies or children dying, those are very important development indicators. In other words, how we rank in the rest of the world. Talk to us of whether or not we've made progress over the past 10 years in this specific area, and other indicators that show that we are moving ahead.
A lot of the health good outcomes depends on the individuals also. Maternal mortality rate is one of the most difficult one for us. We did manage to reach to 0 in 2011, but it's a social product. It's not only dependent on the Ministry of Health. And last year we had 10 maternal deaths. This year we have 7 already. So it's, for us, it's not good. More work needs to be done. Child mortality, we did fairly good. We were more than 100 in the 90s, and we are 15 and 17. So we're not too bad there. The neonatal mortality rate is the one that is the highest right now. We
And
don't
neonatal
have,
is what for it?
neonatal is children below 1 month of age.
Okay.
So when we disaggregate the data, the children, the neonatal deaths with a teen mother is the one that have the highest rate. So we must make all efforts to reduce adolescent birth rate. Worldwide, the adolescent birth rate goes from 1 to 200 girls giving birth in the ages of 15 to 19. Worldwide, the average is 44, and we are at 85. So
Wow.
we have some work to do.
Wow.
But
Is it still 1 out of every 4 live births is to a teen mom? Those were statistics you'd given us a few years ago.
yes, but because we are increasing the contraceptive use, we don't use that indicator much. We
Okay.
rather use the adolescent birth rate
Okay.
because it doesn't mean much, 20%, 25, 15. But the adolescent birth rate is what is telling you out of every 1,000 girls, 15 to 19, how many of them are having a pregnancy. So it's quite a difficult issue to address.
Yeah.
We have the NCFC spearheading the Child Marriage and Early Union,
Yes.
and many persons in Belize feel like that's a cultural practice that we should maintain, but it's something that we need to eradicate, and it's not easy.
Now, some of the biggest barriers in the very area, and by all means, I'd love to hear from both of you in this area. Belize, we have a very strong relationship with the church in the schools and generally within our communities. And some of the programs that have, that the Ministry of Education and Ministry of Health have attempted to integrate, whether it be reproductive health education in schools or opening up access to some of the services to teenagers, teen girls, teen boys. There's been a lot of pushback. The HPV vaccine for a while, there was quite a bit of resistance because many thought that if you give a 14-year-old a vaccine for sexually transmitted diseases, you're telling them go have sex. How do you overcome the morality factor from the country and still push forward for what you know, what you seem to know, or the data is saying is better for the country? How do you strike that balance?
We use the evidence that is available.
Yeah.
If we do not make an effort to reach to every parent for them to have an informed consent for their girl or boy to get vaccinated against HPV, then the acceptance rate is low. But if we sit with them and we show them all the data that we have based on evidence, the response is 9 or 10 out of 10, the acceptance rate. So with the churches, they are fully supporting the HPV, I must say that. And with Ministry of Education, we need to work closely so that we can improve the delivery of the comprehensive sexuality education in school. I mean, no young person should be walking out of school towards adulthood without the basic information and the best opportunity, the golden opportunities in the schools. We often think that sexual and reproductive health, because the word health is there, is the Ministry of Health responsibility. But when you look at the timing at when an adolescent will reach to us, it will be mainly when they're ill.
Yes.
And how much time an adolescent can get ill in the year? 1 or 2 times, 30 minutes with us. When with the Ministry of Education, they spend 6 hours, 4 hours per day, the entire year. So we have a golden opportunity there that we need to capitalize on.
I'm a bit.
Yeah, I just want to add, I agree very much with Dr. Bear. And the reality is information. And just just to highlight in the Caribbean, and Dr. Bear might be able to give the specifics for Belize, but about a third of young people girls are having sex before the age of 14. That's a reality. So they need the information. They need to make choices. They need to understand what's happening, and therefore not providing that information is not helping them at all. So I think what Dr. Bear is doing here is quite correct, quite a good approach. The information and the data must be given to all, to the parents, as you said, the churches and the community, so that, and the other part that I want to also emphasize is health. It's adolescent health. It's not only sexual reproductive health. There are many other things that are happening in a young person's life that need the attention of the health system. I mean, one of the depression and mental health issues, violence, injuries. There are diseases that can be identified fairly early in one's life. And going back to that life course approach, it's every point of your life is important for the attainment of health. It's not as only maternal or as a child or when you're an adult. But if you miss that big gap of that adolescence.
When there's so many changes too.
Yes, exactly. You do need to have access to health for adolescents in all its forms.
I'm always curious to see how we stack up against other people, and your most recent experience has been in Jamaica, who is almost like our older twin. Could you tell us about, I mean, you've been here for a very short time, and so your assessment of what's happening as yet is not as full as it will be maybe in 2 months from now. But could you talk to us about some of the experiences and challenges in terms of the programs that you were part of in Jamaica, and you look at in Belize and say what the opportunities here, maybe in more fertile ground, what some of the challenges are as compared to Jamaica?
There are some things that are common, and I started with non-communicable diseases because that's affecting all of us everywhere in the Caribbean. It's our major cause of death, and therefore the challenges and the same issues in terms of lifestyles that where people drink sugary drinks. It's the same. People love these sugar sweetened soda drinks, and they're killing us.
It's not international though?
No, it's worse. I go to here in Jamaica. That's what you get in the supermarkets. You really haven't got options around it because I don't drink it. I have a diabetic potential, and I have prevented myself from being diabetic for 10 years. I'm sure about that. But that's because I changed my diet. I change how I eat, and therefore, so you need to have that enabling environment that allows you to make the change. So drink, encourage drinking water. So that's exactly the same issue, and therefore the issues around promotion of health and healthy lifestyles need to be similar. And there are some, that's one of the things I've seen with some NGOs there that they're promoting, a healthy, and also the Healthy Caribbean Coalition, participating in some of that effort. Some of the differences is related to, I think, in terms of some of the communicable diseases. Like here, you're focusing on the elimination of malaria. Because in Jamaica there is no malaria. So some of those communicable diseases make some difference. There's still efforts around maternal and child health, especially maternal health, similarly. So there are some similarities because we're not that different, but some small ones, like in terms of you're based in Central America and some of the cross-border issues related to malaria that is in this region of Central America.
Can I ask just plainly, where are we doing well? Where are some areas that just stand out in healthcare or in health education that we can say or be proud that Belize does well in this?
Okay, let me answer this and begin answering it, because I participated in a meeting recently, the Mesoamerica Salute presentation of what was being done here in Belize. And Dr. Bear has not brought it up, but it is excellent to see the change in the indicators, and she would be able to say specifically, but that it was excellent, and in fact it is something that I think need to be expanded even further
Yes.
into other health regions. It showed a change, and within a short time, not 10 years, not 20 years, change that you can see. And so that's an excellent project that I have seen here as well. I see the attention to things like the emphasis on vector-borne diseases, the prevention of vector-borne transmission of, arboviral diseases. So I've seen some of those, but there are good things too. The work in some of the health systems, primary health care. So there are good things too, but we can't say that we've reached it. Nobody reaches there.
No.
It is a continuous journey that we all need to have towards health and to really engage people in their care. I think, and this is for all of us, all the Caribbean and maybe even wider, we have to return to community participation. This is what I knew in my early years of public health. This is where the community participates, play a role, they are engaged, they're part of the planning. But somewhere along the way we lost it, and we need to return to people. Yes.
With Salud Mesoamerica, we are also improving the community platform. We work with one community health worker per community, maximum 2, but that is not sufficient for the promotion of wellness. So the CEO, Dr. Figueroa, he insisted in reviewing the community platform to bring on board other volunteers from the community so that we can improve and expand the promotion of wellness in the community, promoting healthy lifestyle, giving people practical recommendations. For example, get your blood pressure checked every 3 months, get your pap smear for cervical cancer, etc.
Now, public health especially, and I think when we talk about the communicable diseases, the ones that can be transferred, we can talk about some of the interventions that can be spearheaded by different entities, whether it's NGO or governmental, whether it's a spraying program or going into an area where someone was diagnosed with dengue or chikungunya or whatever, and ensuring that the people around there are safe. So there are more proactive measures from external entities. But when we talk about non-communicable diseases, the primary responsibility lies on the individual, whether I'll choose the Coke or I'll choose the water, whether I will exercise or not exercise, whether I will maintain my diabetes or just rely on my pills to regularize. And I'd imagine that's a very hard task to take on. How do we, and you said very early on, Dr. Jack, that this is priority number 1 for this region, that we have to address sugar, pressure, cancer, obesity, what's the other one? And heart diseases, things that lead to heart diseases. What is the plan moving forward?
So, we recognize a lot of it comes from the individual and the choices that make, but you have to have what we call an enabling environment. So the enabling environment is the one where you can make choices in what you purchase and at a price that you can afford. So if the more nutritious food is too expensive, you're going to choose the cheaper food. If all that is around you is sugary, sweetened drinks, and you have been brought up in liking to have a soda or some drink instead of water, you're going to choose that. So the enabling, so one of the things that we're speaking, same with tobacco. So taxation on tobacco to increase the price to make less people purchase it. The same with alcohol, taxation on alcohol. These are part of what we talk, lowering salt in food, normally. And that can be decreased and people are not even aware that that's changing. Because, so this is what we say. So it's the person is responsible for their health and they need to make decisions. But the environment, and that comes to the legislation and policy that we need to also have.
So, for example, Barbados, Dominica, I
Yeah.
think, and well, we have a better example of Mexico, which is closer
Yes,
to
I
us,
know.
ventured into doing policy changes. They put in the sugar-sweetened beverage tax, which means it costs more to buy a sweet drink than it is to get water, for example. These are the type of measures. In Mexico, we know it was effective. I'm not sure what the indicators are saying in the Caribbean.
I think it's too early.
Yeah.
It's just like 2-3 years,
Yeah.
so we need to see the change.
Yeah.
But I think it also need to be also with the promotion of things like drinking more water,
Yeah.
you know. So it's neat.
And it's twofold. It's also
Yeah.
getting local producers to have a limit as to how much sugar they
And-
will put in a
and
drink.
to voluntarily reduce it as
Yeah.
well, because that is also happening. I saw recently is in the papers in Jamaica, one of the manufacturers have voluntarily reduced the amount of sugar content
Yeah.
on their own, and the same with so there are things that in their corporate responsibility,
Yeah.
they are also contributing and look, you know. So yes, these are some. The other thing that we are both in the Caribbean and in Central America, PAHO is supporting the guidance on the front of label packaging, so that
Yeah.
you can see what you are buying, that how much calorie and something that you can understand, because
Yeah.
many of our packaging already has information, but it's kind of difficult to read.
We never learned that in
You
school,
need
by
to
the
even
way.
put on the eyes, the glasses, and even can't read
Or
it.
there's that trick with like 4 serving sizes in
Yeah,
one, so you
yes,
think
so
you're
that
getting
it is
something healthy, but
no.
Yeah.
So the front of label packaging will just be like in like stoplight ones. There's some that give you green, good, you know, orange, red, red. So that kind of thing. We're trying to implement that in the Caribbean, so it will be easier for people to make choices of what in terms of what they purchase.
I use the sugar tax as an example, just where some people are heading with policy. What is the direction in Belize? What are some, and I know from the Ministry of Health and even from PAHO, WHO, the advocacy work takes place behind the scenes. That's not the stuff that takes place at a big, public event. What are we looking at in terms of wanting to change in policy and legislation to build that enabling environment that you speak of?
In regards to there is a work that is started with the Ministry of Education, reducing the sale of food that is not, or how we call it, junk food.
Yeah.
Yeah.
Yeah, to the kids. So it's a first step, but I agree we need to develop policies that can help protect the population at large, that can reduce the consumption of sugar, for example. It is so expensive to deal with the complication of NCDs when it can be prevented, but it's an individual. I'm not the best example for exercise, but
I know that we are being asked to help support, especially that front of label packaging, especially with the guidance that's coming from both Central America and it's happening almost in parallel, and the Caribbean. So Belize being placed in both spaces and benefits from many things that way. What is most applicable to you will be the one that you do. So you'd have that. So that's one of the things. And in terms of the taxation, I'm not sure where you are at with that as yet. But you may not be able to do everything. But even that start of that front, you make a choice.
Yeah.
But of course, people will need to understand to read it. But it's not going to be that complicated. So that's why different countries are different stages. However, some of the things, and that's why the front of label packaging is becoming from a regional, Caribbean or Central American initiative, so that a number of countries will be doing it at the same time instead of just one individual country.
With health, it's a funny thing because PAHO and WHO has had significant success, particularly in polio. I mean, to just get it eradicated. So we have seen where an effective program can actually have far-reaching effects to zero, as you've said, in other areas. My question is more in terms of sustainability and management. How do we, especially when we have limited resources, a country like Belize, how do we not throw away the good work by saying, okay, we've already dealt with, we have malaria under control, no, we have a bigger problem with HPV, let's do that. How do we manage it to make sure that we have all of these boxes who can probably explode each and every one separately to manage them properly with the limited resources that we have?
Yeah, that's an interesting question because we fail to realize that the population grow exponentially and the economics grow very slow, nothing compared to the population. And for health, for example, the human resources for health doesn't grow with the population. As the population grows, as the economics are downward trend. So it's a challenge for us. We would want to do more in the preventive aspect, but we are barely coping with responding to the needs, direct needs of the population. So it's, I mean, when you look at the vector-borne diseases, we have done a great job. And for Belize, with the conditions of the land itself and the climate, and maintaining the elimination of malaria, we were not hit like other countries with chikungunya, dengue is every now and then one or two cases. It's really one of the best success for Belize. The issue of the polio, we only have 4 countries worldwide that still have polio. But with measles is a good example of how people make decisions based on misinformation. In the European countries, they decided not to continue giving, accepting vaccine to eliminate measles. And because of the information on the relationship with autism that was not demonstrated scientifically.
Which this one very unscientific study has been debunked over and over and over and over again. And I still hear people, even in Belize, saying, I don't know about giving my child vaccines.
And now they have large outbreaks. They have people dying from measles. And now the evidence is showing that you can have measles, you get over it, but 16 years after you can develop meningitis, severe to have this person with a severe disability for life if they do survive. So measles is a good example. Our vaccination coverage has been high, but currently there is a reduction, not only in Belize, but in other Caribbean countries also, in the region of the Americas also. We are not that low, but we are not above 95 as we used to be.
Yeah, we were at
so we need to push a little bit more.
90, very high numbers
we
before.
We were above 95, but the challenge is to have more than 95 at community level. So the vaccines are there, we are there, but sometimes they wait till we reach to the home and it's costly for us.
And I think people are being influenced by the voices of people like in the European Union, countries in America too. I mean, because they're the return of all these diseases that disappeared. I only knew them as a young doctor, and they never saw them after that, you know. But now they're returning. Whooping cough, even all these things have returned. And so therefore we need to always be vigilant. We also need to remind people, because many of the younger doctors never saw measles.
So they wouldn't know how to diagnose it if
people
it comes in.
did not experience measles and the mumps and all these things that happened in the past. So they forget, and they've, as well as the community, have not experienced it. So there's the reminders that we have, and the things that we can do quite quickly, because we, as you said, we have the vaccines, and there's a delivery system. You have the health system that delivers the vaccine. So it's just people not wanting to part because they've heard from someone these stories, or
without fact checking for themselves.
Yes, themselves.
I want to talk about something totally different. You're bringing up what are called re-emerging diseases, you're saying, but I want to go in a different direction. One of the things that we have seen over the years, due to globalization and the way people travel and move around the country, are new diseases being introduced in this region that we never saw before. We didn't know, or chikungunyas or Zika, and I think perhaps the most prominent example people can think of is Ebola. And when, you know, everyone was so fearful of it being introduced into their country. It is now so easy for something from far off Asia that we have no resistance to in our bodies because it's not common to us to be here within a matter of hours. How does a health system prepare for the potential of these types of challenges? I mean, this is something that not just for Belize we have to worry about, but globally. How do we prepare?
So in terms globally, there's one, something we call international health regulations, which all the countries, it's a treaty, all the countries in 2005 agreed to. And it includes the monitoring, the diagnostics, the identification, monitoring, and reporting of certain conditions, it's usually infectious conditions. Of course, you have other things, but it's largely infectious, and reporting on them so that they are contained and other countries are aware.
Yeah.
It should not affect travel or trade, but it should enable that other country to prepare and to be able to prevent the entry of that condition. So it is a global agreement. So that's one of the things. But so that requires, however, countries to have the capacity to detect, even if it's a clinical detection, and because you may not have the laboratory detection, but that is, again, you might have some support for that testing somewhere in your region, so doesn't negate the identification. But that kind of thing, and then that reporting. So you also need a surveillance system to report that, and then to look at the data and look at trends and so on. So there are systems that exist. And that is what actually happened with both chikungunya as well as Zika in Brazil, where they identified, especially in Brazil, the emerging cases, which was the very first time in our region of the Americas. So we were a large susceptible population for that condition. But that's it's that
a new reality.
It's a new reality, and it's a way the world can work together. So we have to work together. Yeah. No country could be isolated in their response to health, because of that global travel, connectivity. You know, we need to work together, and so that is kind of the umbrella in which we could identify, detect, report, and contain. Because then there's the support for the response, which is what we did with Ebola, which we were all countries in the Americas were preparing and warning and looking for cases.
Can I ask this in terms of, there surely is a cultural reality in Belize, and I guess the same in the Caribbean. Caribbean people they tend to be, to my opinion, strong. We're strong people, and so that comes with an almost reckless disregard. But I compared to some of my colleagues in America and in Europe, and some of the things that they get sick from, I say in Belize, man, you would die here. But it comes with a cultural disregard for how things work. And so my thing is, how do we approach that cultural hurdle when particularly there's a correlation between prevention and an economic value to not getting it to where you have to be treated? How do we bridge that cultural gap?
You want to start, Dr. Bear? I'll just briefly, but I will pass over to Dr. Bear, because that's throughout the Caribbean, because we have our cultural belief in our foods. There are some foods that we
need a salt beef and pigtail.
Of course, and there's history to that. You know, there's a history why we like these things. You know, so it's some education and continuous communication on this area to know what is good and what is not bad for us. It doesn't change us immediately, but it is that communication that we need, and that information, and then that support to individuals to make the decision whether I should be continuing to have my salt, You may have the salt, but yes, to make changes, but it's information that you have to, and if you don't change, then this is the result.
And that's the second part of it was really just making a connection between the economic value of prevention. I don't understand why we as Caribbean people or Belizeans can't see the connection between, okay, if I eat more bananas and I eat more fruits and I drink more water, then I don't have to buy all of these expensive pills. I don't have to travel to the hospital. Why is that disconnect? I just don't get it.
Can I ask something here? Because that really ties me back to something I think Dr. Berry shown before. What you first introduce your babies to in solid food is what kind of develops their tendencies to what they want to eat later in life too, right? So it goes back to that first 22-month theory.
Yeah,
Tell us a bit more about that.
Parents are the one who teach the child to love sugar or to love salty food, but the child doesn't request the sugar. But if we teach them to drink sweet, that is what they want afterwards.
When they're older.
If you raise a child without giving them ice cream,
But they go to
they
school.
reach to an age where they have the age enough to get the ice cream themselves, and they will not get it. And you will laugh at them, so just a little. But you have some, like me, I love ice cream.
Me too.
You're not alone.
Me too.
You're not alone.
I would eat a lot of ice cream, not only one scoop. So it's taught. It's taught at home.
We're taught some of these things, but and people are trying to do these cost benefit, but they now need to translate these studies into practical terms to communicate them to people. Yes. We can't have, I mean, that's the scientific language. So even the cost benefit of HPV vaccination is one of the things that people are have done. We look at different interventions, but translate it to how what people will understand. Not in big terminology.
Miss Robin can expand on that topic for you, Anne. But between the food that you make at home and the processed food, always go to the homemade food, and that will keep us healthier. And cultural practices. If the cultural practice cause a harm, then we need to change that practice, and that's a challenge for us.
All right, well, we got to close off this conversation. We could go on and on and on and on, but we won't. We'll save something for our next conversation. I will leave with one closing question. If you could advise or encourage Belizeans viewing this at this time, what they can do differently, one thing they can change today that will improve their health and our overall health as a country, what would that be?
Okay, so since diabetes is one of the main non-communicable diseases in Belize, I would focus on that in terms of reducing their sugar intake, but also to have checks to ensure they visit their health centers, have checks, know what's going on early in life, not wait till they present with diabetes, because you can prevent the onset of diabetes by changing the diet. So that will be, I think, one of the things I would say at this point.
All right.
Yeah. First, I would like to big up the healthcare workers and the civil servants for this achievement for Belize. Definitely.
And yourself.
A kudos. And the main and the partners now that we work with, Belize Cancer Society, BFLA, PAHO, UNICEF, UNFPA, etc. But adolescents, we are working towards having our strategic plan. And the more we dive into the data, the more we dive into the issues that they are facing, it's a social product. It has to do with economics, it has to do with education, jobs, etc. So my message would be for adolescents, if we adults are failing to provide them with the information, they have the information at hand, they just have to seek for it. So a practical recommendation, if you have $2 to go on social media or to have access to internet, use one for Facebook and use the next $1 to find about information that will help you to live a better life and make better decisions.
All right.
And that will help us a lot.
Sounds like we have to have a future conversation on adolescent health. But
Yes.
that's all we can cover for this
Okay.
morning. Thank you so
Thank
much for
you.
coming in.
Okay,
Thank you
too.
very much.
All right. We're going to go ahead and take a break. When we come back, we'll be talking to representatives of Belize Excelsior High School about their ongoing recruitment. So stay tuned.